Washing my hands. Privacy. Good afternoon.
Good afternoon.
My name is Manpreet and I'm a student nurse from Sheridan College. I'm here to conduct a health history with you. I will be asking you questions about your overall health and personal history. Please answer to the best of your knowledge. Just to let you know, anything we discuss will stay confidential between you and I and will not be revealed to anyone. Is it okay if I go ahead with the interview?
Yeah, go ahead.
May I please get your name?
Sukhman Karsand,
What is your age?
19 years,
What is your gender?
female.
What is your ethnic background?
I'm Indian.
What languages do you speak?
I speak English, Hindi, and Punjabi.
What is the reason you're here today?
I'm feeling very weak, dizzy, and fatigued.
When do you feel those symptoms? Tired, weak, dizzy?
In the early morning when I get up, and in the afternoon.
So you would say you feel those symptoms throughout the day?
Yeah, like mostly in the early morning
Mhm.
and the afternoon.
On a scale of 1 to 10, 10 being the most, how weak and tired do you feel?
8 out of 10.
How often do you get these symptoms?
These symptoms are getting from the last few weeks.
How long have you been experiencing these symptoms?
From last couple of months.
Couple of months?
Yeah.
Is this the first time you're experiencing something like this?
No, I think it's from the last 6 months.
Have you had any childhood illnesses such as measles, mumps, rubella, chickenpox, asthma, or jaundice?
I have a chickenpox in my childhood.
How old were you?
5 years at that time.
Have you had any incidents or injuries as a child?
Yeah. I fall from the terrace and I have inner in my outer ear.
You have a
Nail?
nail in your outer ear?
Yeah.
Is it out now?
Yeah.
Okay. Have you had a follow-up with the doctor regarding that?
Yeah.
Everything's okay?
Yeah.
Have you had any other serious or chronic illnesses such as diabetes, hypertension, heart disease, or mental illness?
No.
Have you ever been hospitalized?
No.
Have you had an operation for any reason?
Yeah, I have stitches.
You had stitches?
Yeah.
How old were you?
8 years?
Did you have a follow-up with your doctor?
Yeah. At that time, but now, like, after I'm good, like...
Okay.
Yeah.
Have you ever been pregnant?
No.
So you don't have any kids?
No.
Have you had any abortions?
No.
Any miscarriage?
No.
Are you up to date with your immunizations?
Yeah.
When was your last flu shot?
December 1st last year.
And your last TB skin test?
October 28.
And that was a 2-step TB test?
Yeah.
When was your last tetanus vaccine?
October 21st.
Okay.
Last year.
Last year?
Yeah.
When was your last visit to the primary healthcare provider?
2 weeks ago.
And what was the reason?
I have a sprain in my left arm.
How did you get the sprain?
My doctor said might be left something heavy, so that's why.
Okay, and they did all the tests and everything was okay?
Yeah.
When was your last pap smear?
I never go through the pap smear.
Do you know what that is?
No.
So it's a test used to check for abnormalities that may indicate cervical cancer.
Okay.
So we recommend that you do that test every 3 years when you're 21.
Okay.
Do you have any allergies to any medication, food, or environment?
That's from contaminated area, like from the dust.
And what symptoms do you get when you're near that?
Sneezing,
Mm-hmm.
difficulty in breathing. So,
And do you take any medication for that?
no.
Okay. Have you ever been to the doctor for that and gotten any follow-up on why you get those allergies?
Yeah, one time my doctor said like it's like according to the area.
Okay.
It's not like from everywhere. It's
Okay. Just to want to make sure it's not anything serious.
Okay.
Are you taking any medications over the counter, prescription, or any herbal remedies?
Yeah, I'm taking Falafel for my iron deficiency.
Okay. Any family history of chronic diseases such as diabetes, hypertension, high cholesterol, mental illness, or cancer?
My mother have high cholesterol problem and hypertension.
Any other history of Any other family history of diseases such as asthma, obesity, or pneumonia?
No.
Do you have any health problems related to your skin or history of it? Such as dry skin, eczema, rashes, redness, bruising, sores?
No.
Do you have any health problems related to hair, such as hair loss, dry scalp, head lice, or oily scalp?
No.
Have you ever had head lice?
No.
Do you have any health problems related to your nails or history of such as pale colored nails or yeast or fungal infections?
No.
Do you have or ever had problems with headaches or migraines?
No.
Have you any problems with your neck, such as swollen lymph nodes?
No.
Do you have difficulty hearing?
No.
Any ear infections?
No.
Ringing in ears?
Mhm.
Do you wear glasses or contacts?
No.
When was your last eye exam?
2 months ago?
Okay, and you didn't require any glasses, right?
No.
Do you have any other issues related to your eyes, such as dry eyes or infections?
No.
When was your last self-breast examination?
I never go through the breast examination.
Okay, do you know how to do one?
No.
Okay, I can provide you with more information later on if that's okay with you.
Okay. Sure.
Do you have any history of asthma, bronchitis, or pneumonia?
No.
Any history of any heart disease such as hypertension, cholesterol, atrial fibrillation, or congestive heart failure?
No.
Any history of atherosclerosis, poor blood circulation, or vascular disease?
No.
Any history of gastrointestinal diseases such as gastritis, GERD, or ulcers?
No.
Any history of any UTI, STI, or STD?
No.
Are you sexually active?
No.
Any history of joint pain, arthritis, any sprains or strains?
No.
Any neurological illnesses such as seizures, epilepsy, mental illness, or MS?
No.
Any blood-related illnesses such as anemia, bleeding?
No.
Any history of hypothyroidism, hyperthyroidism, or diabetes?
No.
How do you feel about your overall self-esteem?
I feel great and confident.
Very good. Do you exercise regularly?
No.
Do you get enough sleep?
Honestly, no. I used to sleep for only 4 to 5 hours.
Okay, and why do you think that is? Do you have any trouble sleeping?
No, I just a habit to go for bed late.
Okay. Are you eating well?
I don't think so.
No? How many meals do you eat a day?
1 or something too.
Are you a vegetarian?
Yeah.
And what type of vegetarian are you?
I like to vegetarian.
What does your typical meal consist of?
It consists of curd, bread,
Mm-hmm.
salad, and sometimes milk.
So do you get any protein in your diet at all?
No.
Since you're
like,
a vegetarian, I understand it's
not that
difficult.
much. I don't think so.
Okay, do you drink milk?
Yeah, sometimes.
Do you live alone or in a family?
I used to live in family.
You used to?
Yeah.
Do you live alone now?
Yeah.
Do you have any support from anyone if you need to talk about something?
Yeah.
Would you consider yourself to be spiritual?
Yeah.
And are you religious?
Yeah.
Do you have a lot of stress in your life?
Yeah.
How do you manage your stress? And do you have any coping strategies?
Yeah. Firstly, I prefer to go out of the situation, like those who give me stress,
Mm-hmm.
and otherwise I used to listen music.
Okay, and your stress is school related or work related?
It's basically school or personal life.
Okay.
Yeah.
Would you relate your stress to not eating well?
Yeah.
Any history of smoking cigarettes or marijuana?
No.
Do you drink alcohol?
No.
Any history of any street drugs such as cocaine, heroin, or meth?
No.
Do you believe you have any environmental hazards
No.
at home or your community?
No.
Any intimate partner violence?
No.
Do you work?
Yeah.
Do you believe your work to be a hazard?
No, it's a safe place for me. So it's not like anything
Okay.
for me.
Based on your assessment, you are lacking nutrition in your diet. So I suggest that you need to incorporate more protein in your diet because you're not, since you're a vegetarian, I don't think you're getting enough protein. Also going to give you a guide that tells you how much of each group you need, how much of each food group you need daily in your diet.
Okay.
It'll have all the recommendations and it'll give you a very nice explanation.
Okay.
Also, I recommend you get more exercise in your diet, and you try to exercise at least 2 or 3 times a week for an hour.
Okay.
Everything else seems okay. It's just your nutrition and lack of exercise. Do you have any questions for me?
No, that's fine.
Okay, thank you very much.
Thank you.